In this video, we will talk about maternal illness, maternal infection, and congenital deformations.
Doctor, if I get ill during pregnancy, does any kind of illness can affect my baby?
Yes, Mrs. John.
Can you, please, quote some examples?
Yes, sure, Mrs. John. Let's continue the video. Maternal illness, such as diabetes mellitus, phenylketonuria, and epilepsy, can cause fetal abnormalities.
Doctor, please explain that how disease of my wife can affect our child?
Yes, sure, Mr. John. First is diabetes mellitus. High maternal blood glucose levels in early pregnancy due to type 1 diabetes mellitus is associated with a 2 to 3-fold increase in congenital abnormalities, including heart disease, neural tube defects, and femoral hypoplasia.
Doctor, what is femoral hypoplasia?
Well, femoral hypoplasia is a disease characterized by the absence of both femurs. The causative influence is high maternal blood glucose levels in early pregnancy. Next is phenylketonuria. Uncorrected, high maternal blood levels of phenylalanine can cause severe mental retardation, microcephaly, and congenital heart disease.
But, doctor, what is the cause of this disease?
Well, the basic cause is deficiency in phenylalanine hydroxylase. This enzyme is necessary for conversion of phenylalanine into tyrosine. So, in the early days, there is severe vomiting and convulsions. There is learning disability, and the baby's skin can become dry and eczematous. Untreated patients have a mousy smell due to phenylacetic acid in the sweat and urine and muscular hypertonicity. And life expectancy is reduced. Next is epilepsy. So, babies exposed prenatally to anti-epileptic drugs. There is 2 to 4 times increased incidence of birth defects in babies. And the number increases if more than one drug is used. They include oral clefting, genitourinary abnormalities, and heart and limb defects. Learning difficulties and behavior problems are increased.
But, doctor, if pregnant mother is suffering from epilepsy, so she won't use anti-epileptic drug?
No, Mrs. John. Anti-epileptic drug must be taken by pregnant women suffering from epilepsy. But the recommended maternal medication is single drug treatment if possible, avoiding sodium valproate. Next factor causing fetal stage abnormalities is maternal infection. Maternal infection during pregnancy refers to an infection that affects the mother while she is pregnant. These infections can range from mild to severe and can have various effects on the mother and the developing fetus. So, microorganisms that cause multiple malformations are toxoplasma, syphilis, treponema pallidum, rubella, cytomegalovirus, and herpes simplex.
Doctor, I cannot remember them. Please simplify them. Or use some mnemonic.
Sure, Mrs. John. Microorganisms that cause multiple malformations are summarized by the acronym TORCH. So, T for toxoplasma, O for other. For example, syphilis, treponema pallidum. R for rubella, C for cytomegalovirus, and H for herpes simplex. Mrs. John, remember that. The most important are Toxoplasma, rubella, and cytomegalovirus.
But why, doctor?
Because, Mr. John, in case of toxoplasmosis, maternal infection with the toxoplasma confers a 20% risk to the fetus during the first trimester, rising to 75% in the second and third trimesters. Other important microorganism is rubella. Rubella virus causes cardiovascular malformations in 15 to 20% of all babies infected in the first trimester. In case of cytomegalovirus, risk is greatest if infection occurs during the first trimester. About 5% of infected pregnancies result in fetal damage. Moving to other factors causing fetal stage abnormality. And that's congenital deformations. In our previous video on congenital abnormality, we discussed that this green traffic light represents normal healthy embryo, while the arrow is representing the development of normal organs and tissues. Now, structure forming normally. Then the extrinsic defect occurs in fetal life. That will alter the structure. So we can say, deformations are mechanical distortions.
And, doctor, I remember that. We have also discussed that clubfoot is an example of deformation.
Yes, Mr. John. Now, let me explain how normal structure turns into clubfoot. When the structure forming normally intrauterine force acts as a result of the intrauterine force, one of the deformations rises, called as clubfoot. Now, other examples of congenital deformations are congenital dislocation of the hip. Other congenital deformation is amputations. There is limb amputation due to constriction by amniotic bands formed by premature rupture of the amnion. Other congenital deformation is pyloric stenosis.
Doctor, what is pyloric stenosis?
Well, pyloric stenosis is a problem that affects babies between birth and 6 months of age and causes forceful vomiting. That can lead to dehydration. So, before ending this video, Mr. John, can you revise main factors causing fetal abnormalities and few of their detail?
Yes, sure, doctor. We have talked about the maternal illness, maternal infection, and congenital deformations. So, maternal illness such as diabetes mellitus, phenylketonuria, and epilepsy can cause fetal abnormalities. Next was maternal infection. Maternal infection during pregnancy refers to an infection that affects the mother while she is pregnant. These infections can range from mild to severe and can have various effects on the mother and the developing fetus. So microorganisms that cause multiple malformations are Toxoplasma, others such as syphilis, Treponema pallidum, rubella, cytomegalovirus, and herpes simplex. Microorganisms that cause multiple malformations are summarized by the acronym TORCH. So, T for Toxoplasma, O for other, such as syphilis, Treponema pallidum, R for rubella, C for cytomegalovirus, and H for herpes simplex. Last was deformations. So, in deformation, structure forming normally. Then the extrinsic defect occurs in fetal life. That will alter the structure. So we can say deformations are mechanical distortions. Examples of deformations are clubfoot, congenital dislocation of the hip, amputations, pyloric stenosis.
So this was all. In our next video, we will talk about malformations, drugs, and physical agents.
Ditch the hefty textbooks and embrace the convenience of learning on the go. Our interactive video content keeps you engaged, making learning medicine enjoyable